Welcome to our today's presentation. And in our today's talk, we want to have a look at a topic called convulsions. Ladies and gentlemen, convulsions is a very common condition or presentation. And therefore, it is very important for us to have a look at what it is and then later on characterize the various causes of convulsions. So let's start by defining what convulsions is. Convulsions refers to uncontrolled or involuntary jerky movements of the body which occurs as a result of rapid contractions and relaxations of the body muscles. So that is the simple definition of convulsions. Now I want you to take note that convulsions is different from seizures. But convulsions is commonly or common during seizures. So that is a very key point that we need to take note of. And I will repeat that convulsions is different from seizures, but convulsions is common during seizures. So that should come out very clear. Now there are several causes of convulsions, and let's have a look at these causes one by one. The first one is called electrolyte imbalance. So then therefore any condition that results into electrolyte imbalance may result into convulsions. For example, patients who have suffered or are suffering a condition referred to as gastroenteritis or simply GE, causing dehydration that can either be severe dehydration or dehydration with shock. The second cause of convulsions is referred to as metabolic diseases, and in this case they are also very several. The first one is the complications of diabetes mellitus, for example, hypoglycemia, that is extreme low blood sugar levels below 2.2 millimoles per liter. The second one is hyperglycemia, and that is an elevated blood glucose levels above 11.1 millimoles per liter. The next one can be diabetic ketoacidosis, simply referred to as the DKA. Other metabolic disorders that can also cause convulsions include hyperthyroidism and hyperparathyroidism. The next cause of convulsions is referred to as the brain tumors, and brain tumors are also on the rise now that we have the rise in cancers. Now the next cause of convulsions is called the congenital brain disorders or brain defects, and in this case we can have one, the Dandy-Walker syndrome, number two, the Arnold-Chiari syndrome, or even the hydrocephalus. And hydrocephalus is also a very common brain defect. The next cause of convulsions is referred to as drug and substance abuse, for example, the abuse of alcohol or even drugs such as amphetamine. The next cause of convulsions is electrocution, and this is a shock that comes as a result of electric current, and that is why it is termed as electrocution, and this can also destabilize the electrolytes. The next cause of convulsions is referred to very high temperature, what we call pyrexia or hyperpyrexia. And ladies and gentlemen, if you want to understand in details about pyrexia, then click into our video, which is rightly available on this channel, where we talked about pyrexia or fever. And this is common in children, a condition we refer to as febrile convulsions. The next cause of convulsions is called trauma, particularly the head injuries as seen in either accidents or direct assault on the head. The next cause of convulsions is poisoning, and this is common with organophosphate poisoning. Other causes of convulsions may include: 1. Things like toxemia or pregnancy complications as seen in pregnancy-induced hypertension, and that is eclampsia. The next cause of convulsions is uremic syndrome, and this is accumulation of excess urea within the system, and this is common with patients with kidney diseases or kidney failures. The next cause of convulsions is alcohol withdrawal syndrome, and this is also on the rise. Vascular diseases can also cause convulsions. For example, malignant hypertension that then complicates into hypertensive emergency. We can also have stroke or even embolism. The next cause of convulsions is systemic infections, what we call systemic septicemia. And this can either be in form of bacterial infections, fungal infections. We can also have viral infections or even parasitic infestations. Other causes of convulsions can be brain infections, as seen in meningitis or even encephalitis. And this can also take the form of either bacterial, viral, fungi, or even parasitic infestations. Now, other causes of convulsions can also be animal bites, and this is very common with snake bites or poisonous snake bites. We can also witness this with dog bites. Now, ladies and gentlemen, these are just but a few various causes of convulsions, and this list is not conclusive, for there are other more causes of convulsions. And convulsions may point out a very serious underlying illness, and therefore any client developing features of convulsions should be taken to the nearby health hospital for quick medical intervention as soon as possible. And if you are watching us for the very first time, kindly subscribe. And until next time, it's goodbye from all of us.